Hello everybody, good afternoon. My name is Guadalupe Cortez. I am a student at Grand Canyon University. The purpose of this video is to discuss ethical issues surrounding healthcare. The principles of scientific communication include clarity. Information should be presented in a clear and concise manner. Any unnecessary language should be avoided to prevent the audience from getting confused. Accuracy. The information provided should be presented in attention to detail and avoid any misinformation to the public. Simplicity. It should be explained in a way that is easy for the target to understand. The way to keep your audience engaged with your research is that the topic should be relevant to the audience. The information should also be credible. By doing this, you provide accurate information and are transparent to help keep your audience engaged. By citing references, you can help build credibility. The second topic we will be discussing are ethical implications in healthcare research. Ethical implications refer to the potential moral consequence that can arise from certain decisions or consequences, in this case, human research. It is important to ensure the protection of human subjects and the integrity of the research. But as an allied healthcare provider, it is crucial to adhere and understand ethical principles that relate to this. There are 3 ethical principles that I will be discussing. The first one being respect for persons. This one emphasizes the respect of the autonomy of the individual and protects those with diminished autonomy. This means obtaining informed consent. The participants should know and be fully aware of the research, the potential risks, the benefits, and they should have the right to withdraw at any and all time. The second principle is beneficence. This refers to the obligation to minimize harm and maximize benefits. Now, with this being said, the participant's well-being should be ensured. Researchers should take the necessary steps to help avoid any physical harm to the patient. Also, they should be conducting risk-benefit analysis to outweigh any harm or risk to the patient, and if that is needed, terminate the research. Lastly, the last ethical principle is justice. It involves that all the benefits and the burdens of the research are shared evenly. Our third point includes ethical issues in communication and research. Research in healthcare often involves very sensitive information and vulnerable populations. That's why it is important to consider the ethical issues surrounding communication, and one should avoid any miscommunication or misinterpretation of any information provided, because it can lead to any ethical issues down the road, such as lawsuits. Patient privacy and confidentiality. The researchers should have the obligation to protect the privacy of the patient. The fourth point in our subject is how to communicate effectively with patients, family members, and healthcare providers. Clear communication in healthcare is crucial. It paves a way for safe diagnosing and treatment. A patient-provider relationship consists of effective communication, building trust, talking to one another, listening to one another, to voice a concern, and to help find an answer. When talking to a patient, family members, and other coworkers, one should talk with the utmost respect, active listening, concentrating, giving them the full attention, maintaining eye contact. One should also practice empathy, understanding and sharing the patient's feelings, the family members' feelings, your coworkers' feelings. But the most important one is the nonverbal communication. Be aware of the body language you are expressing. Be aware of the stance, of how you're holding your hands, of gestures, of expressions. Some things may be perceived as not caring. Our last and final point is how to effectively communicate skills in formal writing. Some tips to consider for effective communication writing is to be direct. Say what you want to say directly. Another tip is to revise and continue revising, doing rough drafts. Looking for ways to improve your language is very important, as it enhances your way to expand and communicate better. Lastly, ask for feedback from your coworkers, from upper management, from doctors, to see how you're doing. Reach out to a colleague and mentor. Ask them to give you feedback on your writing so you can improve on your skills and see where you are lacking and see where you are good. Practice makes perfect. You can do it. Thank you for watching my video. I hope that it was educational and you can pick up some points. As an allied healthcare provider, these are very important things to have in the back of our mind, all for the benefit of the patient. Thank you.